We aren't collecting email addresses from people on this call, are we?
No, we're not. No.
I didn't think so.
Thanks.
Seconds, leaving messages now. Hello, and welcome to our live telephone town hall meeting. Thanks for being on the phone with us. We'll be joined in a moment here by Jane Ogle, the former director of the California Department of Healthcare Services, and we're here to talk about CalMediConnect. Now, if you already have a question you'd like to ask about CalMediConnect in mind, go ahead and push 0 on your phone right now or at any time during this call, and we'll get you up to ask that question during our forum. Jane's very knowledgeable. She'll be answering plenty of questions tonight, so don't be shy. We very much want to have that interaction. We'll also be running some poll questions, and you'll be able to vote on your touch-tone phone, so stick around for those. We want to get some feedback from you in that way as well. So I'm going to repeat my introduction here just a couple more times. We're dialing out to thousands of Californians right now, and we appreciate your patience while we get started. You're on a live telephone town hall meeting with CalMediConnect on behalf of the California Department of Healthcare Services. We have former director of the California Department of Healthcare Services, Jane Ogle, on the line with us. So if you'd like to ask Jane a question about CalMediConnect, please press 0 right now. We're going to discuss the new CalMediConnect program. CalMediConnect is a new healthcare program here in California. It will combine your Medicare and Medi-Cal benefits into a single plan. You won't lose current services if you decide to join, but we do want to describe the choices you have as we implement this new program. So if you have any questions about those choices, about CalMediConnect, please press 0 on your phone right now. Also, you should have received a blue packet from the California Department of Healthcare Services Healthcare Options Division. We'll be referring to those blue packets throughout this call, so please grab your blue packet now if you have it handy. Again, you should have received a blue packet from the California Department of Healthcare Services Healthcare Options Division, so we'll be referring to those blue packets. If you have yours handy, please grab it now. I'm going to repeat this introduction one more time, and then we'll go ahead and turn it over to Jane to get us started. You're on a live telephone town hall meeting with CalMediConnect on behalf of the California Department of Healthcare Services. We have former director of California Department of Healthcare Services, Jane Ogle, on the line with us. She's here to answer your questions. If you'd like to ask her a question, I see plenty of you are doing so now. Go ahead and push 0 on your phone, and we'll get you up to ask those questions during our call. We're going to answer as many as we can. We're going to discuss the new CalMediConnect program. It's a new healthcare program here in California, and it will combine your Medicare and Medi-Cal benefits into a single plan. You won't lose current services if you decide to join, but we do want to describe the choices you have as we implement this new program. For those of you who may have just joined us, you should have received a blue packet from the California Department of Healthcare Services, and we'd like you to grab that blue packet if you have it handy, because we'll be referring to it throughout this call. So again, remember to push 0 on your phone if you have a question you'd like to ask, and I'll go ahead and turn it over to Jane Ogle to get us started. Jane, take it away.
Thanks very much, and thanks everybody for joining us tonight to talk about CalMediConnect and the choices and options that you have available to you as we implement CalMediConnect and the Coordinated Care Initiative here in California. Just one more housekeeping note. For your protection and privacy, if you have a question, you don't have to give the screener your full name. Just your first name or a nickname or however you wish to be addressed will be fine. I ask you to keep your questions general. We can't go into specific details about your health condition or your health plan on tonight's call. If you have specific questions about your individual situation and your health condition, or you want assistance with making a choice about CalMediConnect and the Coordinated Care Initiative, you can call HICAP, the Health Insurance Counseling and Advocacy Program, HICAP, at 1-800-434-0222. That's 1-800-434-0222. And you can make an appointment with a volunteer in your local HICAP office to help you work through the decisions. As was mentioned, we will be referring to the letters and packets that you have received from the Department of Healthcare Services throughout this call, so you may want to have them handy. The large package you received included the CalMediConnect Plan Guidebook and CalMediConnect Plan Choice Book. The guidebook is a shiny covered book with about 23 pages. The choice book is a dull covered colored cover with about 10 pages. And if you have those nearby, it might be helpful. If you receive these materials in a different, or if you need to receive these materials in a different format, in Braille or in large print or in an audio version, you can call Healthcare Options at 844-580-7272. That's Healthcare Options at 1-844-580-7272. They can also help with replacement of lost cards. So now I'm going to ask the moderator to ask the first polling question.
Good thing. Thanks very much, Jane. And for those of you who are live on the line with us, we'd like you to vote in our poll. We want to know how many people knew about CalMeta Connect before this call. Again, how many people knew about, how many of you were aware of CalMeta Connect before this call? Press 1 if you have heard about it. Press 2 if you have not. We want to know how many of you out there in our audience have heard about CalMeta Connect before this call. Press 1 if you have heard about it. Press 2 if you have not. Jane, back to you.
Thanks. And so we've invited you to participate in this call because you or someone in your household is eligible for both Medicare and Medi-Cal. As you know, Medicare covers your doctor's visits, your hospital stays, and your prescription drugs. Medi-Cal covers any extra costs that Medicare does not cover in full, as well as medical supplies, long-term services and supports like in-home support services, community-based adult services, multi-service senior programs, or nursing care, nursing home care. In addition, Medi-Cal covers such things as non-emergency medical transportation and other services like that. Your Medicare card is a red, white, and blue horizontal stripe card that says Medicare Health Insurance on it. Your Medi-Cal card says State of California and has a picture of the state seal on it. You'll see pictures of those cards on the fourth page of your guidebook. Now you have new choices. The CalMedi Connect plan will combine all of your Medicare and Medi-Cal services into a single plan. They will provide you all of the same Medicare and Medi-Cal benefits that you currently receive, but will also integrate your in-home support services, your multi-service senior program services, and any long-term nursing facility services that you might have. In addition, your over-the-counter drugs that you receive through Medi-Cal will be integrated into that program. It doesn't cost you anything to join. If you have a share of cost in Medi-Cal today, you will continue to pay that, and there is a small copay for Part D prescription drugs. If you've received the blue envelopes with the guidebook and choice forms, you have a decision to make about your health care. You also received a letter assigning you to a CalMedi Connect health plan on the first day of your birth month. This assignment was made based on the plan in which your primary doctors are contracted. So the State Department of Healthcare Services reviewed Medicare data and looked to see where you receive your care from what doctors and specialists, and assigned you to a plan based on those physicians being contracted with one of those plans. If you agree with this assignment, you don't have to do anything, and you'll automatically be enrolled into the plan that's indicated on that letter. If you don't agree with this assignment, you can make several choices. You can choose to join a different CalMedi Connect plan, and your choice book will show what other CalMedi Connect plans are available to you. If you want to stay in regular Medicare where you are today, you can do that, but you must choose a Medi-Cal plan for your Medi-Cal benefits. So on the choice form, you simply pick a Medi-Cal plan and not a CalMedi Connect plan, and that will keep you in Medicare the way you're receiving your services today. You also have the choice to pick a PACE plan if one is available in your area, and your choice form will indicate a PACE program if there is one available. If you want to be evaluated for PACE, you must be over 55 and you must be at a level of disability that would otherwise make you eligible for nursing home care. But that you can ask to be evaluated for PACE if you want to elect to go into PACE. These are a lot of complicated choices. I think the most important thing for you to do is talk to the HICAP people or talk to your doctors or any trusted advisor whom you have to help you make the decision that's right for you. Now I'm going to stop and take some questions.
Very much, Jane. And a reminder for those of you who may have just joined us, this is a live telephone town hall, so if you'd like to ask general questions about CalMedi Connect, please press 0, as many of you have. And those of you who have been pressing 0, we'd like to keep your questions general. If you have specific questions, you can call HICAP at 1-800-434-0222. And our first question is going to come from Seema. Seema, you're live. Go ahead, please.
The thing is, we decide to don't choose MediConnect. We want to have our Medicare you put it like that and don't change it. The Medicare is very important to us. I want to have my doctor, my own doctor, everything I have. I don't want to change just my Medicare. Me and my husband too.
Okay. So in that case, Seema, when you look at the choice form, you want to pick a Medi-Cal plan. And that's if you're looking at the choice form, it's the right-hand column. And just pick one of those Medi-Cal plans for the Medi-Cal benefits and the coverage of the Medicare cost sharing. That will automatically put you in a Medi-Cal plan, but leave your Next question.
Much, Seema. Appreciate you being on the line. We're going to go to our next question live from Jay. Jay, you're live. Go ahead.
Okay. Is it mandatory for you to change your Medicare or Medi-Cal? I have a son that's on dialysis, and he wants to keep his doctor, and he wants to keep it the way it is already.
So one of the groups that cannot join CalMedi Connect are people who have end-stage renal disease and are on dialysis. So he would not be eligible to join CalMedi Connect. He will have to pick a Medi-Cal plan for his long-term services and supports, but he won't be joining a CalMedi Connect plan. And so he'll receive information only about picking a Medi-Cal plan for his long-term services and supports.
Very much, Jay. Thank you, Jane. And a reminder, you can push 0 to ask a question, as many of you have. But we'd also like to remind you, if you just joined this call, we're going to be discussing the Blue Choice packet that you received from the California Department of Healthcare Services Healthcare Options Division. If you have that blue packet handy, go ahead and grab it now. Our next caller is Michael. Michael,
Hello?
you're live. Go ahead.
This is Michael?
Yep, you're on. Go ahead.
Yes, I was calling. Everybody else seems to be concerned about the same thing that I am. Is about keeping their doctor, because I have had my doctor almost 17 years. I'm epileptic, and I want to know. I would like to just stay on Medicare. And there, you said there's also a plan just for Medi-Cal plan. I can just switch just for that too.
That's correct, Michael. So I think it would be important for you to talk with your doctor and find out if he's participating in CalMedi Connect, because that's one choice that you would have. If he's not participating, then you will have to pick a Medi-Cal plan, but you can stay in regular Medicare the way you are today.
Okay, appreciate the question, Michael. We're going to go to our next question right away, and it's Sandy. Sandy, you're up. Go ahead.
Hello? Yes.
Yes.
Yep, you're live on the line with Jane Ogle. Go ahead, please.
Yes, I'd like to know if the same thing is for cancer patients as for dialysis patients. Can they keep the same plan?
So the only specific disease category that is prohibited from participating in CalMedi Connect are people who are on dialysis. All other people will be offered the opportunity to participate in CalMedi Connect, but you can make a decision to stay in regular Medicare if you would like. You must make a decision on the Medi-Cal side for those Medi-Cal benefits that I described that are not your doctor benefits. They're those in-home support services, adult day care centers benefits, and nursing home benefits, not your doctor benefits.
Andy, appreciate your question. Go to another live question in a moment here, but I'd like to remind folks that if you have a very specific question you'd like to ask about your specific condition, not a general question about CalMedi Connect, you can call HICAP at 1-800-434-0222. And we've got Juliet up live next.
Yes.
Juliet, go ahead.
Hi. Yes, hi. I just want to get the blue package. And I was listening to different people asking questions from another person, which I was not aware who are they and why I have to be online. They asking the questions. I mean, nobody was hearing me. That's my.
So if you've received a blue packet from the Department of Health Care Services, we called you to help you understand that blue packet and answer any questions that you might have about it.
Juliet, and we're actually simulcasting this event in Spanish, so we've got a question from the Spanish side of the event, and we're going to translate the answer to your question for those folks, Jane. The question's from Paula in Venice. She says, will medical benefits be the same, or are they going to change? Do you have an answer for Paula's question?
Sure, thanks. So your medical benefits will remain the same. There are some additional benefits to participating in CalMedi Connect, including a little additional vision benefit that includes glasses, frames, and annual vision exams rather than every other year. And then non-emergency or non-medical transportation benefits, up to 30 rides a year of non-medical transportation to help you get to your doctor or other medical appointments. Those are and then the third benefit that will be available through CalMedi Connect is something called Care Plan Option Services. So in working with the plan, if they discover and you discover in describing your needs that you need something like a ramp or maybe an air conditioner or help with infestation of anything in your house, the plan can provide those services to you as an option and part of your care plan. Each person who joins a CalMedi Connect plan will have a care plan and can have a care team if they want one to help them manage their benefits. Go ahead. Next question.
Yep, we're going to get another question from the Spanish side, and then we'll go right back to your questions here on the English side next. Mercedes from LA asked, does Medi-Cal and Medicare last a lifetime? I have had both for over 30 years and have never had issues. Can you answer Mercedes' question, please?
Sure. Medicare eligibility actually does last once you become eligible. There are rare circumstances when somebody goes back to employment and loses and drops out of Medicare while they're employed. Medi-Cal eligibility is redetermined annually, and a person must continue to, respond to those requests for annual redetermination that assesses their financial need and eligibility for Medi-Cal. So that continues. That's an annual redetermination.
Much. going to go to our next question from our live audience here, and it's Clara. Clara, you're live. Go ahead.
Yes, thank you. I attend one of the county health facilities. I see the doctors at one of LA County health facilities, and I had asked them when I received the blue package, and they suggested that I take LA Care 800. But I want to know, what does that particularly cover under the 800 LA Care, code 800 under the LA Care on the left side of the health plan choice form. And I received the second package, blue package. Does that mean I need to apply 2 times?
No, and I'm sorry that you received a second packet. You should not have received a second packet. One is sufficient. By choosing LA Care 800 on the left-hand side, you're choosing to join the Cal MediConnect program through LA Care. And LA Care will provide all of your Medicare benefits, all of your Medi-Cal benefits, all of your long-term services and supports, and as well as those additional benefits that I mentioned of some additional vision benefits and non-emergency transportation benefits. So those benefits will all be provided through LA Care, and they will be the plan responsible for helping you to coordinate all of your benefits and services.
Jane, thank you for the question, Clara. We're going to go to our next question right away, and it's Carol. Carol, go ahead.
Hello?
Yep, you're live. Go ahead.
Hello?
Carol, go ahead with your question. Yep, you're live. Go ahead
Hi.
with your question, please.
Hi, my name is Carol, and I received the blue packet, but I didn't know is it too late to send it back, or can I go ahead and send it back to you?
You can send it back at any time up to the first day of your birth month, and then if you join, if you decide that Cal MediConnect is not for you, you can choose to opt out at any time, and that will be effective the first day of the next month.
Carol, appreciate that. And we're going to go to our next question, and we've actually got web participants on the line as well. So I'm going to take one of our questions from those that are participating via our webcast. Mr. D says, my doctor doesn't take HealthNet of the others listed. Should we keep Medi-Cal? Can you take that one on, Jane? Did that question make sense to you?
So the doctor is a Medicare doctor, and if he doesn't take HealthNet, then he needs to talk with his doctor about whether or not he should join Cal MediConnect. He still has to pick a Medi-Cal plan, and he can pick HealthNet as a Medi-Cal plan in LA or San Diego counties. So he can still pick them for the Medi-Cal benefits if he doesn't want to have HealthNet for his Medicare benefits.
Got your question answered there, Mr. D. Thank you for being on our webcast. We're going to go to our live phone audience here, and we've got Bobby up next. Bobby, go ahead.
That's my question was, I have LA Care, and I go to the county facility. My doctor is at Cartier Hudson. I want to know, would any of this change from me seeing the doctor that I have?
No, it wouldn't change if you're already a member of LA Care.
So I should just go for Medicare, the plan?
That's right. That would probably be a good idea for you to just go with the LA Care Cal MediConnect plan.
Thank you very much, Bobby. Let's go to our next live question from Walker. Walker, you're up. Go ahead.
Hi, this is Walker. I had a question in regards to my mother's home health care. They told me that they wouldn't be covered if I changed to Cal MediConnect. I'm just wondering why that is.
That's a great question, and I don't know that I can answer it specifically, but I'll give you a sort of a general answer. If your mother's receiving in-home support services, that won't change at all, and she'll still be the person that hires, fires, manages, and supervises her IHSS worker. If she's receiving home care services, if the plan is not contracted with if the home care provider is not contracted with a Cal MediConnect plan, it's possible that you would have to change home care providers if you join Cal MediConnect. But that's as far as I could figure what they're saying, that they're not contracted with any of the Cal MediConnect plans in LA County. And just to remind everybody, there are 5 Cal MediConnect plans in LA County: LA Care, HealthNet, Care First, Care More, and Molina Health Plans. How about the next question?
Very much. Yep, and thank you, Walker. Appreciate the question. We're going to go to a really commonly asked question. We actually just got this question in our Spanish side as well. So let's take John. John, go ahead.
Yeah, I didn't get a blue packet in the mail.
If you haven't received the blue packet yet, it could be because you're not in the cycle yet for your birth month. We actually wanted to do a polling question to ask how many people have received the blue packet. So, Ian, could you go ahead and do that polling question?
Absolutely. All right, so we want to know how many people on this call have received your blue envelope with your choice packet in the mail. Press 1 on your phone if you have received your packet. Press 2 if you have not received your packet. So again, how many people on this call have received your blue envelope with your choice packet in the mail? Press 1 if you've received your packet. Press 2 if you have not received your packet. Thanks for that participation. For your participation in this call, we're going to go to Sarita's question live next. Sarita, go ahead, please.
Hello? Yes.
Yep, you're up.
My name is Sarita. I received the blue packet, and I would like the Medicare plan for with transportation, my vision.
So, Sarita, you have 2 choices there. You also received a letter that said, we think you would best fit into this plan, and it lists the plan. And if you like that plan, you don't have to do anything, and you'll be enrolled in that plan on the first day of your birth month. If you want to pick a different plan, then use that choice booklet or call Healthcare Options at 1-844-580-7272 and ask them what other choices you have in your county.
Let me ask a question, please.
Sure.
Is the plan that I was talking about is the best plan for me? I got a little date saying congratulations that I had been accepted in the Medicare plan. It will pay for all your health care provider.
So I think if you want to make that determination, you should call the member services people at that health plan and ask them to tell you why the plan is good for you. You were assigned to that plan based on the physicians and the physicians that you used being members of that plan. But you should call member services and talk with them about it. I just wanted to go back to the blue envelope question before. If you have not received a blue envelope, it is because your birth date is in the future enough so that we haven't sent it out yet. So the way the process works is you get a 90-day notice telling you that 90 days before your birth month, telling you that this is coming, and then at 60 days you receive a letter with a plan assignment and the choice form and the guidebook for you to decide whether or not you like that plan assignment. Then at 30 days you get a reminder note saying that we're going to enroll you into this plan if you don't do anything before the first day of your birth month. And then on the first day of your birth month you'll be enrolled in the plan if you do nothing. up to the last day of the month before your birth month, you can choose not to enroll in the Cal MediConnect plan, but you will have to pick a Medi-Cal plan for your Medi-Cal benefits. After the first day of your birth month, if you are enrolled, you can always choose to disenroll from the Medicare plan at any time, and that'll happen the first day of the following month. I just wanted to be clear about that so people understand that they have quite a few options available to them.
Jane. And Sarita, thank you for coming in with your question. We're going to go to a couple of questions from our Spanish side, and then we'll get right back to some of your questions here on the English side. We've got Maria in LA asking, I need help figuring out which plan best fits my needs. I really need help. How can you help her out with that, Jane?
Sure. So the best way to do that is to call HICAP at 1-800-434-0222 and ask for an appointment with a HICAP volunteer. They are specifically trained to help you make this decision.
Very much. Our next question from our Spanish participants is Luz from LA. I have both Medi-Cal and Medicaid, and am now being told that I need to also buy into a health care plan. Do I really need to buy into a plan? I don't want to. Can you answer Luz's question?
So first of all, he doesn't have to buy into the plan. He can elect to join the plan, but there's no money involved in this from somebody who is eligible for both Medicare and Medi-Cal. There are no premiums for the Cal MediConnect plan. If he chooses to join a Cal MediConnect plan, then he'll receive both his Medicare and Medi-Cal benefits through that plan. He can still choose just to join on the Medi-Cal side for his Medi-Cal benefits and leave Medicare in the regular Medicare the way he receives it today.
Those questions, Maria and Luz, and thank you for your answer, Jane. We're going to go to our next question live, and it's Diane. Diane, you're up.
Yes, hello. How are you?
Good. How are you?
I'm doing good. Now, I have received the blue packet, and I did fill out my forms, and I returned them in. I selected LA Care Health Plan, which I can keep everything just as it is. My question is, the blue and white hard card, Medi-Cal card, can I use that to go to the dentist?
Yes, you can use that to go to the dentist.
Okay. Thank you.
Okay.
That's my question.
Very much, Diane. Appreciate it. Being on the call. Glad we could answer your question. We're going to go right to our next one, and it's Lorraine. Lorraine, you're up.
Okay. My name is Lorraine. How are you? I have cancer. I've had it for 15 years. My doctor is not accepting this MediConnect, and I took the papers to him, and he said he's not going to accept it. I don't want to go to MediConnect and something else. I have HealthNet, and I wonder if HealthNet will cover. Can I stay in my Medicare with my doctor, my oncologist, and do I have to change the HealthNet?
No, you don't. If you have HealthNet for your Medi-Cal and you have regular Medicare for your Medicare seeing your oncologist, you can leave that just the way it is. But you need to either call Healthcare Options or you need to send back in the form saying that you pick HealthNet for the Medi-Cal services.
Very much, Lorraine. And we're going to go to our next live question from Cheryl. Cheryl, go ahead.
Hi. Good evening. I'm calling on behalf of my mother. She didn't receive the blue and white packet. I think it's because we relocated. So is it the Social Security? Who do I contact to get a blue and white packet? And then her birthday is in July. So you answered part of the questions that I wanted to ask. Since her birthday is in July, that means I have to make a decision. She has to make a decision before July 1st, right? If her birthday is in July.
Right. Yes. So you need to call Healthcare Options. Call Healthcare Options 1-844-580-7272, and they can either help you make a decision or they'll send you a packet.
Did you get that number written down, Cheryl?
No.
Okay,
Could you do it one more time, Jane?
I can. 1-844-580-7272. And
okay, so
go ahead.
Okay, I got it. Thank you very much. So what? Just the second part of that question. So my mother is not dialysis, but she is end-stage renal disease, and so if that's a potential, is there some type of plan as far as the Medi-Cal part? Because right now she goes to a medical group to see her PCP, and her nephrologist is actually in a different area.
So since she has end-stage renal disease, she would not be eligible for CalMedi Connect, which may be why she didn't receive a blue packet. But she will, in the next couple of months, have to make a decision about her Medi-Cal, and you can look forward to receiving information about that in the mail.
Jane. Thank you so much, Cheryl. We're going to go to a question from the web before we get back to our live audience questions. Web participant Jennifer in Torrance asks, so will regular Medi-Cal cease to exist at some point in the near future? Jane?
The state has made a conscious effort to move people into managed Medi-Cal for a bunch of reasons, most of which are because in managed care plans, we can hold the plan responsible for making sure that you are receiving access to services and good quality services. In fee-for-service, we don't have as much control over what kind of services and how accessible those services are. So the state has made a decision to move as much of our population into managed Medi-Cal as we can, and that's happening in every county across the state. But fee-for-service Medi-Cal will continue to exist for people when they just enroll in the plan or in Medi-Cal, and for people who have what's called emergency Medi-Cal.
Thank you very much, Jane. And thanks for that question, Jennifer. Thanks for participating online. We're going to go to Danny live next. Danny, go ahead. Danny, are you there?
Yes.
Danny, you're live on the line. Go ahead with your question, please.
Yes, I have a question about MediConnect. I don't need I don't actually need the in-house services or anything like that. What I need is the eyeglasses. I need the eyeglasses. Can I get that with just the Medi-Cal and the Medicare, the vision? Or
sure. So there is a Medi-Cal benefit for eyeglasses that gives you an eye exam and glasses every 2 years. The CalMedi Connect benefit is to have an eye exam annually and have slightly different glasses frames. So you can, I would suggest that you contact HICAP to ask them what would be the best way for you to go forward.
Question? Go to our next one, and it's Michael.
Yeah, hold on, please. I read the CalMedi Connect plan when it first came out, and I participated in a focus group here in Los Angeles County. In one of the earlier versions of this document, it stated that you did not have to change anything, and then when I read further into it, it mentioned something about having to change within the next 6 months. Can you clarify that for me?
I'm not sure I can. You have to make a decision about your Medi-Cal when you receive the documents, and that is regarding your in-home support services and other long-term services and supports. You also have to make a decision about your Medicare. None of your benefits change. it might be the providers who change, but I'm not quite sure what the 6 months is in reference to. I'm sorry.
Much, Michael. We're going to go to our next live question from Melinda in a moment, but we've got another question from our Spanish participants. Jose asks, I am being charged $21 for my benefits for Medicare and Medi-Cal. I have called several times, but still don't know why I'm being charged. This is why I am unable to pay this. Can you address his comments?
Is that a web question or a Spanish question?
Yeah, he's participating in the Spanish.
Could you ask him to just elaborate and get back to him? Who is charging him the $21? Just if I could know that, then I can answer his question.
Okay. And
so we could go to another question, and maybe he could expand on that question.
Yeah, we'll try to get back with him. Let me get Melinda up live next.
Hello?
Melinda, go ahead.
Hi.
Yep, you're up.
I'm sorry. Listen, I don't know anything about a blue packet. You know, I'm legally blind here. My vision is very impaired. But I got this big package in the mail from, Molina Healthcare. Now, I want to know, they sending me a healthcare program, that's going to work for me, for my particular things that I need? Is that what it's for? So I got a plan that I don't know anything about, really. I've been trying to have someone to read it to me and understand what's going on here, but I'm concerned about going back to see my eye doctor. I've been seeing the same eye doctor for 8 years, and I don't believe it. I don't believe anything has changed. Can you help me with that part there?
Yes, I think what you need to do is call the member services people at Molina Health Plan and ask them those questions and have them walk you through what they sent you and explain it to you. You can also ask them to send that information to you in an audio format or large print or whatever is more comfortable for you to receive. And they have to do that. But I think you should call Molina Health Plan. There's a number in the packet that they sent you and ask those questions to their member services department.
Go to our next live question from Kathy. Kathy, go ahead.
Hi, my name is Maria. I have a question. For Medicare is going to cover what is Medicare going to cover and what is Medi-Cal going to cover?
Okay, thank you. So Medicare Part A covers your hospital and nursing facility stays, nursing home stays for short term in the nursing home. Part B covers your doctor visits and some drugs that are given in the doctor's office. Part D covers your outpatient prescription drugs, and those are all covered under CalMedi Connect by the CalMedi Connect plan. On the Medi-Cal side, the plan covers in-home support services, adult day health care, community-based adult services, multi-service senior program services, long-term nursing home stays, non-emergency transportation, over-the-counter drugs, and then Medicare cost sharing that exists and that Medi-Cal is responsible for paying. So those are the two sort of separate packages of benefits that are available through Medicare and Medi-Cal, and CalMedi Connect brings them all together into one package with a team to help you negotiate and manage all of those benefits.
Very much. I'm going to go to our next live question from Kathy. Kathy, go
Hello.
ahead.
Okay, hello. I have HealthNet, Medicare, and Medi-Cal. Do I have to change it?
No, you will stay right where you are with HealthNet, Medicare, and Medi-Cal. You'll be getting a note towards the end of 14 about moving that entire program from one part of HealthNet to another part of HealthNet, but that you don't have to change anything.
Kathy. We're going to go to another question from our Spanish simulcast. Orpha from Downey says, I am in LA Care. Are my benefits going to change? Jane?
No, your benefits are not going to change if you're in LA Care. And if you're in LA Care, you'll be offered LA Care on the Medicare side as well, and you can choose to join LA Care for both Medicare and Medi-Cal.
Now we've got another question from our web participants. Rita says, I have Medicare, Medi-Cal. I have WellCare Express. I am a diabetic with kidney problems. My primary doctor does not take CalMediConnect. I do not want to change doctors. What do I need to do to use WellCare Express for my Part D services? Jane?
So, since you're a member of WellCare Express, you will stay in WellCare Express. After the first of the year, you'll be offered a Medi-Cal plan to join for your long-term services and supports. And the Medi-Cal plan will work with WellCare to coordinate your benefits.
Question, Rita, and thanks for your participation online. We're going to our next live question from Gloria. Gloria, go ahead.
Yes, thank you. I have Medi-Cal and Medicare, and I haven't received the blue packet yet. But my social worker told me that I had to change from Medi-Cal to Medicare. Otherwise, I would lose my in-home social service, and I would lose her as well, which is my social worker. Now, is that true?
So let me assure you that nothing will change with your in-home support services. And your social worker at the county will remain your social worker. The in-home support services program is going to be working with the Medi-Cal health plan in your county. So whatever Medi-Cal plan you choose will work with the in-home support services program at the county to make sure that you're getting the right number of hours and that your care is coordinated. But you don't have to do anything, and nothing will change for your in-home support services.
Gloria? I'm going to go right to our next live question from Olga. Olga, go ahead, please.
Hi. My mom has some memory loss, and she doesn't recall ever receiving a blue package. I am her caretaker at this time. My question to you is that since she doesn't recall that she's received anything, and her birthday is July 1st, I'm kind of worried. Do I have a short time to make changes for her, or because we don't want to change anything as we are right now with Medi.
So you need to call Healthcare Options and tell them that at 1-844-580-7272. Healthcare Options, 1-844-580-7272. And you can walk through your mom's choices with them.
Did you get that number, Olga?
Yes, I did. Thank you so much.
I'm going to go right to our next question from Erlene. Erlene, go ahead.
Yes, hello, good afternoon to everyone. I received a white package, and I united with HealthNet. I am a cancer survivor, and I did not want to change any doctor because my doctor has treated me for the last 5 years, and so far everything is going well. My concern was I did hear one lady say that later on you got to switch in your HealthNet. I don't quite understand that because I don't want to
So if you participate in HealthNet for your Medicare benefits, yes. In January, nothing will change. HealthNet will do an administrative change, but nothing in the way you receive benefits through HealthNet will change. It's simply an administrative change that will bring some of the Medi-Cal benefits in line with those Medicare benefits that you're receiving from HealthNet.
Dr. Lean? I go to Mohammed next. Mohammed, you're live on the line. Go ahead, please.
Hello?
Go ahead.
Mohammed, you're live with Jane Ogle. Go ahead.
Hi, sorry, I think I got my answer. The last, couple previous questions, they answered my question, so I'm good. Thank you, guys.
Thank you.
Go to Claire's question live next then.
Hi, my
Go ahead.
question is regarding the Medi-Cal portion. Is there a medical exemption form? I think Healthcare Options has it, that you can actually keep your Medi-Cal intact the way it is if you get this particular form. I think it's HC 101, and you can keep your Medi-Cal as is without having to join a managed care plan.
So if you don't have Medicare, if you are a senior or person with disabilities who has only Medi-Cal as the primary health insurance program for you, and you receive your doctor and hospital services through Medi-Cal, you can request an exemption, and you can call Healthcare Options and ask for that exemption. If you have Medicare as well as Medi-Cal, and you receive your doctor and hospital services through Medicare, you cannot request an exemption from Medi-Cal, because the medical exemption is for medical services, and the services that you receive when you're eligible for both Medicare and Medi-Cal on the Medi-Cal side are not doctor and hospital services. They're the long-term services and supports and the transportation and over-the-counter drug services that I talked about.
Sure. Our next live question from we were going to take Kathy left next, but Kathy hung up. So we're going to go to a question from Anna on our Spanish simulcast. She said, I was tricked into picking a health care plan that I do not think will benefit me. Is it still too late to change it? Can you answer Anna's question, Jane?
Sure. No, it's not too late to change it. If she hasn't been activated in that plan, if it's not the beginning of her birth month, she can opt out and stay in a Medi-Cal plan and in in fee-for-service Medicare and regular Medicare. If she's already been enrolled in the plan, she simply has to call Healthcare Options and tell them that she wants to disenroll from the Medicare plan. And the number to call is 1-844-580-7272.
Okay. Go right away to our next question. Lynn. Lynn, you're up.
Hi. My question is, I have an adult son that has Medicare and Medi-Cal, his special needs, and he's enrolled through LA Care with Kaiser. Is there anything that I have to change? I never received the package.
No, you don't have to change anything, because since he is a Kaiser member, he is exempt from enrollment and would not be eligible to enroll in CalMedi Connect. So he will stay right the way he is.
Go to our next question from Agnes. Agnes, you're up. Agnes, are you there? Like Agnes might have walked away from her phone. Agnes's question is, she said she needs help filling out her forms, doesn't understand, needs instructions to follow up. Where would you send her, Jane?
So if she wants help with filling out the forms, I recommend that she call HICAP at 1-800-434-0222 and make an appointment with a HICAP counselor to help her fill out the forms.
And Agnes, we go to our next question live from Spirit. Spirit, go ahead.
Hi. Yes. Hi. My name is Spirit Olivia. Okay, so my name is Spirit. I am a Los Angeles County resident, and I have full scope Medi-Cal and regular Medicare. My birth month is July. I was set on a CareMore MediConnect plan due to start July 1st, and I can change it by the 27th of this month. However, I want to stay on regular Medi-Cal and regular Medicare because two of my doctors, including my surgeon, who's due to operate on me next month and another time as well after that, does not accept Medi-Cal, and so I don't want to be forced on a Medi-Cal plan. The 20% also, and then the 20% then Medicare, Medicare doesn't pay, Medi-Cal pays. That was my understanding. And so if I decide to go with him, the surgeon and the podiatrist who does accept Medicare but not the Medi-Cal plan, am I going to be responsible for that 20%, or is there a way that I can get an exception and stay in regular full scope Medi-Cal?
So, as this plan rolls out, as Cal MediConnect rolls out, and everyone has to join a Medi-Cal plan, the responsibility for the 20% goes to the Medi-Cal plan. So the state is no longer responsible for it. We have delegated that responsibility to the Medi-Cal plan. You, as a Medicare and Medi-Cal beneficiary, are never responsible for the 20%. And frankly, it's illegal both in federal law and state law for any provider, doctor, or hospital to bill you for that 20%. You should never have to pay that 20%. I want to repeat that 2 or 3 times. You're not responsible for that 20%, and it's against the law to be billed for that 20%. So if you want to keep your Medicare doctors the way they are, you do have to pick a Medi-Cal plan, but you don't have to pick a Medicare plan, and you need to call Healthcare Options at the number I gave you to talk about your choice there. So 1-844-8580-7272.
Very much, Spirit. Appreciate you being on the call, and thanks for your question. We're going to go to our next question live from Michael. Michael may have hung up. It doesn't look like his question is coming in. We're going to run a polling question. We'll see if Michael comes through. Our final polling question of the evening goes like this. We want to know how many of you thought the information on this call was helpful for you. Press 1 if it was very helpful. Press 2 if it was somewhat helpful, and press 3 if it was not helpful at all. Again, how many of you thought that this information that you received on this call was helpful? Press 1 if it was very helpful, press 2 if it was somewhat helpful, and press 3 if it was not helpful at all. Thank you very much for your participation in that poll and for your participation in this call. We've actually just about run out of time in our hour-long forum here. Jane, for those of you who didn't get your question answered, I'll go ahead and read that phone number that you can call HICAP again if you have some specific questions you'd like to address. It's 1-800-434-0222. And I'll go ahead and turn it back over to Jane Ogle to close this out. Jane?
And I want to thank everybody for your participation. As Ian said, if you didn't have your questions answered tonight, you can call either HICAP for specific questions about Cal MediConnect and Medicare, or you can call Healthcare Options for questions about the plans available to you. Healthcare Options is 1-844-580-7272. You can also send an email to info, I-N-F-O, @calduals.org, CALDUALS.org, and we'll try to answer your questions. So thank you very much for your participation tonight, and if you have more questions, please contact HICAP or Healthcare Options or send an email to calduals.org. Thanks again.